Thank you, Mr. Williams, and a pleasant good afternoon to everyone. This afternoon, I will share with you the Health Emergency Operating Committee's situation report for Wednesday, March the 30th. I will begin by providing a review of our COVID-19 response over the past 2.25 years. Our response to COVID-19 spans 2.25 years, from January 2020 to present. So it was December the 31st, 2019, that the World Health Organization brought this unusual virus and unusual presentation of respiratory tract illness being identified in China. In January of 2020, the WHO declared it a public health emergency of international concern. And then on March 11th, 2020, the WHO declared the COVID-19 outbreak a global pandemic. In March the 31st to April 25th, 2020, we had our first strict lockdown. And then the cruise industry reopened in July 2021. So this just highlights some significant occurrences over this past 2.25 years. It was January the 23rd that the Ministry of Health increased its presence at the Robert Llewellyn Bratcher International Airport, when we strengthened our port health surveillance and begun screening inbound passengers. And it was on March the 25th, 2020, the then Minister of Health, Honorable Wendy Phipps, announced the first 2 COVID-19 cases in the Federation. It was on that day that NEOC, the National Emergency Operating Center, was activated, and also the Health Emergency Operating Center. Both were activated on that day, and we started having regular meetings of the HEOC. It was February the 22nd, 2021, last February, that we started administering the Oxford AstraZeneca COVID-19 vaccine, and then it was the 1st of September, 2021, that we rolled out the Pfizer BioNTech COVID-19 vaccine. So this provides a summary of the significant events that took place in our response to COVID-19 pandemic. In terms of the health and travel protocols that have kept us safe, these are some landmark dates. Okay, so it was the 31st of October that we reopened our airports to inbound air travelers. All inbound air travelers at that time had to complete 14 days of quarantine. And then it was May the 1st, 2021, the quarantine period for the fully vaccinated inbound air traveler was reduced from 14 days to 9 days. And then we had a further reduction in this quarantine period on the 12th of July, 2021. And then on the 6th of October, 2021, the quarantine period was reduced to 24 hours. And then on December the 11th, 2021, all inbound vaccinated travelers could enter and integrate into our society without any period of quarantine. Now, on the 1st of March, the unvaccinated or partially vaccinated returning nationals, they could spend or complete their 7-day quarantine period at home without the security facility. And then the most recent change that was approved by Cabinet comes into effect this Friday, April the 1st, when all inbound travelers can submit, or you have the option of submitting a negative rapid antigen test for entry into the Federation. So this just summarizes the major changes to our health and travel protocols over the past year and a half. As I said before, it was March the 25th that we announced our first 2 cases, and this just provides you a snapshot of the media release that was issued or disseminated on March 25th, 2020, when we announced the first 2 cases that were identified almost midnight Tuesday, March 24th, 2020. It was on June the 17th of last year that we recorded our first COVID-19 death. Between then and now, we've recorded 43 COVID-19 related deaths. The most recent took place on Sunday, and I want to just pause and extend my deepest sympathy to the friends and family of the deceased. Now, this slide provides an overview of the 4 waves of COVID-19 infections that we have successfully contained. And so the first wave of COVID-19 infections took place between March the 24th and April the 15th. So ladies and gentlemen, it took us 1 month to contain the first wave of COVID-19 infections. In this wave, we added 15 cases to our COVID-19 tally. And then between April the 15th, 2020 to May 19th, we added 30 positive cases of COVID-19 over that period. Our borders were open, and those 30 cases were all imported cases. They were all inbound travelers. Our second wave of COVID-19, it took us 2 months to contain the second wave, between May 19th, 2021 to July 15, 2021. In this wave, we added 610 positive cases to our tally, and we recorded 3 COVID-19 related deaths. It took us 3 months to contain our third wave, between August the 15, 2021 to November the 15, 2021. In this period, we added 2,167 positive COVID-19 cases, and we recorded 25 COVID-19 related deaths during this time period. It took us 3 months to successfully contain our fourth wave, between Christmas Eve last year, December 2021, to March 29, 2022. We added 2,727 positive cases in the fourth wave. We've only recorded 15 COVID-19 related deaths during this period. Please note that the Lambda variant of COVID-19 drove the second and third waves, and the Omicron variant was responsible predominantly for the fourth wave. And I think we can say it was the original strain of COVID-19 that drove the first wave. And in terms of COVID-19 testing as a federation, we have tested. Our testing rate has been acceptable, and we've been we got support from 5 labs. So at this time, we have 5 labs providing us COVID-19 testing capabilities. And so we have the lab at Alexandra Hospital, we have the lab at the JNF General Hospital, and we have 3 private labs. And so our COVID-19 test rates has been at an acceptable level. So this is a summary of the 4 waves of infection that we have successfully contained. Our current COVID-19 status, I'm sharing with you some roses, pictures taken. In terms of our vaccination program, 82.9% of the adults in our population have received the first dose, and 77.8% of the adults in our population are fully vaccinated. 9.7% of the adults have come forward and received their booster shots. In terms of the children, 12 to 17 years, 19.1% have come forward and received the first dose of the Pfizer vaccine, and 17.5% of these teenagers are fully vaccinated. This slide shows the data or vaccination data disaggregated by island, and as you can see, 56.3% of the total population, St. Kitts and Nevis, are fully vaccinated, and we have one of the highest COVID-19 vaccination rates in the Caribbean, and for this we must be proud, and we want to thank the people of the Federation who trusted us in terms of the information we provided, and you came on board and you accepted the vaccine. And so this is the summary slide that shows that 5,549 laboratory-confirmed cases of COVID-19 have been reported for the Federation. Ladies and gentlemen, we have 0 active cases at present. 5,506 cases have successfully recovered, and to date we've recorded 43 COVID-19 related deaths, and you can see the data disaggregated by island, St. Kitts and Nevis. This shows the relevant data with respect to the COVID-19 related deaths. You can see about 2/3 of the cases were male, so there are preponderance of males who have died from COVID. Majority of the cases were unvaccinated, almost 84%, and most were older adults, over 60, and with chronic underlying conditions. And so this just highlights, provides you the information regarding the changes to our health and travel protocols that become effective this week, Friday, the 1st of April. All inbound air travelers are permitted now to submit a negative COVID-19 RT-PCR test or a rapid antigen test. The RT-PCR test must be done within 72 hours of arrival, and the rapid antigen test must be done within a day prior to arrival in the Federation. The samples, nasopharyngeal, oropharyngeal. Please note that we are not recommending self-administered tests or home test kits. Prior to coming here, I got a call with respect to the rapid antigen test, and in response, what I would say is, if you're coming to St. Kitts from the United Kingdom, you can do the rapid antigen test within 1 day of travel and submit same before coming into the Federation. You could upload same on your KNA travel form and you'll be good to go. Now, in terms of the World Health Organization global targets, there are 4, whereby all territories, jurisdictions globally will be assessed in terms of their response to COVID-19, and they are hoping that each territory can vaccinate 70% of their people by mid-year this year, 2022. In St. Kitts and Nevis, we've already attained the 56.3% mark, and they are hoping that each territory can achieve a minimum testing rate of 100 tests per 100,000 people per day. And in the Federation, we've already passed this minimum. In terms of provision of care for all of our cases, all our COVID-19 laboratory confirmed cases have received adequate care, either from our case managers, hospitals, health centers, and all our essential healthcare workers have been protected by PPE, appropriate PPE, and by vaccination coverage. And so we are doing quite well in terms of the WHO global targets. All right, so this is a big question. Will COVID-19 go away? Will it get worse? Will it fade into the background? Will it become a seasonal flu? And so the scientists are trying to come up with the answers to these questions. And so there was an interesting article in the New York Times on the 28th of March, whereby the scientists are already beginning to answer some of these questions. The virus's Omicron variant was significantly more infectious and more resistant to vaccines than the original strain that emerged in 2020. And so there's no reason, at least biologically, that the virus won't continue to evolve. So in other words, the consensus is that going forward, the coronavirus, the COVID-19 virus, will continue to evolve and mutate. This is a slide taken from that same article in the New York Times, whereby on the x-axis it shows the estimated reduction in the effectiveness of the antibodies generated through vaccine, meaning the current vaccines that we are using. And then on the y-axis, it shows the level of infectivity or transmissibility of the various COVID-19 variants. And as you can see, the Omicron variant is the most contagious to date, and it is the variant that has evaded the current vaccines the most. And this trend, what the scientists are saying or suggesting, is that this trend will or may continue. Taking all this together, we expect SARS-CoV-2 will continue to cause new epidemics, but they will increasingly be driven by the ability to skirt the immune system. In this sense, the future may look something like the seasonal flu, where new variants cause waves of cases each year. And so going forward, what they're trying to say is that we can expect a surge in cases from time to time. And these new variants that will evolve may continue to evade the current vaccines. And so the scientists, they have their work cut out for them in terms of their ability to develop broader variant-proof vaccines. So in other words, going forward, as a people, as a federation, what would we have to do in terms of COVID-19? Well, we need to we're going to have to depend on the non-pharmaceutical measures and depend on the broader variant-proof vaccines that will be developed. And so the COVID-19, the non-pharmaceutical measures or the COVID-19 protective measures remain. The vaccine, the COVID-19 vaccine provides a layer of protection against COVID. And those of us who are vaccinated, we have benefited and continue to benefit from the immunity gained from or through vaccination. And then the wearing of the face mask will continue to be very important as we go forward and face the emerging strains of the COVID-19 virus. And hand hygiene will continue to be very important, and our ability to maintain our distance as far as possible will also be very important. And, the last point in terms of persons who are experiencing respiratory tract symptoms, it's really important for you to stay at home and get tested. because it may be COVID, it may not be COVID. And so the COVID-19 protective measures will continue to be very important as we go through the rest of 2022 and 2023. Ladies and gentlemen, it has been 2.25 years that we've been coming to you in terms of providing you the HEOC situation report. And we've been coming to you, providing you the latest scientific information regarding the virus and the vaccines. And you've listened, you've gained our trust, and you've come on board in terms of accepting the vaccine. You've come on board in terms of adhering to the COVID-19 protective measures. And it is this afternoon with deep pleasure that I say thank you for your support over this past 2.25 years. Thank you, thank you, thank you.
And thank you, Dr. Laws. We now have Superintendent Cromwell Henry, who will give us his presentation.
Good afternoon. Thank you, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast via whatever means. I must first apologize early. In my haste to get here, I forgot my spectacles, and so I may have a bit of a challenge reading my notes. But nonetheless, I'm familiar with the material, and so I should be able to get through. But just in case, I apologize in advance. The security forces continue to do our part to ensure that our federation remains safe. We have done so in collaboration with other security agencies, as well as the Ministry of Health. We have gone through 4 COVID-19 waves of infection